Good afternoon, everyone. Welcome to the Georgia Smart webinar series. Today's webinar is titled Improving Equity Through Smart Community Planning. This is the fifth webinar in a series where we bring you Georgia Tech researchers and professors to discuss topics related to smart community development. I'm Greg McCormick, director of the Georgia Smart Communities Challenge, a technical and financial assistance grant for Georgia communities developed by Georgia Tech and sponsored by Georgia Power, the Atlanta Regional Commission, and a group of community and governmental organizations throughout Georgia. The Georgia Smart Communities Challenge request for proposals for 2020 is now open. If your community would like to apply for funding up to $100,000, as well as research and technical support from Georgia Tech to study or pilot smart technologies in your community, please consider applying. You can find all application information on our website, which is linked in the chat area of today's webinar. I'd also like to mention a new webinar series that we're hosting during the month of May. Please join us for Georgia Smarter Together every Thursday in May from noon to 1 to hear from more Georgia Tech researchers and professors on various topics from biomaterials to the economic impact of COVID-19. Again, that's every Thursday in May from noon to 1, and you can find more information and links to the webinars on our website in the Events tab. Before we get started with today's webinar, a few housekeeping reminders. Please keep your audio and video muted throughout the presentation to limit interruptions. We will be taking questions at the end of the presentation through the chat area of BlueJeans, so please feel free to submit your questions at any time in the chat area, and we'll answer them at the conclusion of today's presentation. This webinar is being recorded and will be posted to our website for later viewing, as well as a copy of the slides. And you can find that and all of our other recorded webinars in our Media tab in our website. So without any more delay, I'd like to introduce today's presenter, Dr. Arthi Rao. She's a research scientist in the School of City and Regional Planning at the Center for Quality Growth and Regional Development. She's a research partner for the Macon-Bibb County 2019 Georgia Smart Project. Her research focuses on healthy communities, where her extensive background in GIS, urban planning, and epidemiology helps her perform her research. She works with big data sets and has become an expert on healthy communities research and geospatial methods. She also teaches courses titled Public Health for the Built Environment and Public Health Analytics at Georgia Tech. Welcome, Dr. Rao.
Thank you, Greg, for that introduction. I just want to make sure everybody can see my screen and hear me just fine.
I can, so I think you're good to go.
Okay, thank you very much. So hi, everyone. Good afternoon and welcome. Thank you for joining us today. As Greg mentioned, my name is Dr. Arthi Rao, and I am a research scientist with the Center for Quality Growth and Regional Development at Georgia Tech within the College of Design. My primary research interests lie at the intersection of urban planning and healthy communities. I focus on the social determinants of health that primarily drive health outcomes and disparities. And I'm very excited to share with you today the broader conceptual thinking that informs my research and how that has led to my interest in smart community planning. And I'm very grateful indeed for the opportunities offered by the Smart Communities Challenge to further explore these areas of research interest. So I'd like to begin my presentation today with a thought-provoking image. This image to me brings up two different states of thinking or dualities. While we are in awe of the various technological developments and the promises of the future that come along with it, it also conjures up in my mind images of the digital divide. To what end are we using these technologies, and is it within everybody's reach? The ability to access the internet has become increasingly important to be competitive in the economic, political, and social arenas of everyday life. However, not everyone has access to this technology. The idea of the digital divide refers to the growing gap between the underprivileged members of our society, such as the poor, rural, elderly, and handicapped populations who do not have access to computers or the internet, and the wealthy middle class and young Americans living in urban and suburban areas who do indeed have access. On the one hand, the more privileged sections of our society continue to adopt new technologies faster, whereas the groups with lower access continue to lag behind. According to the National Telecommunications and Information Administration, this gap is widening along economic and racial lines. It is important to remember that availability is just one aspect of access, and it is important to consider other barriers to digital access, such as financial, cultural, and behavioral traits. Research has shown that lack of access directly limits educational opportunities and indirectly limits access to employment opportunities and health and medical care to lack of information, collectively affecting intergenerational socioeconomic mobility. As a planner, the aspect of addressing the needs of underserved populations is definitely not a new one to me. In fact, it is deeply embedded in the ethics of the profession, and I will quote what the American Institute of Certified Planners uses as their code of ethics and professional conduct. We shall seek social justice by working to expand choice and opportunity for all persons, recognizing a special responsibility to plan for the needs of the disadvantaged and to promote racial and economic integration. We shall urge the alteration of policies, institutional decisions that oppose such needs. So embedded within these ethics is a need to address the needs of disadvantaged populations, but also become advocates for the less advantaged and promote the development of policies and other instruments that actually serve to mitigate some of these divides. And the image on the right, which you have probably seen many times, explains very well the difference between equality, equity, and justice. So you begin with offering equal benefits and equal supports to everybody, but then you move to an equity framework where everybody gets the supports they need, which could be different depending on your level of disadvantage. And then you move to the framework of justice, where the structural barrier, the fundamental barrier that that inhibits access is primarily removed. So the supports are not needed anymore. So I'd like to also start briefly by talking a little bit about the work that we do at the Center for Quality Growth and Regional Development and how equity is really embedded in everything, in all of our topical areas of research. So I begin with the Smart Communities research, which I'm currently participating in with Macon Bib, and I will talk a little bit more about that in depth later on in my presentation, so I won't get into too many details on that one. But the idea of regions and megaregions, which is probably a new concept to some of you, but it's really looking at new scales of development that transcend political boundaries, and how communities are coming together to bridge these geographical locations, particularly the interest of emerging technologies and other environmental conditions such as hazard mitigation, climate action planning, and how we need new models of governance to understand what this large regional planning looks like, and how do we then better measure and better account for disparities through these different political boundaries and different models of governance. The next area of research that I'd like to talk about is through transportation and infrastructure. Again, we have looked, for example, at the outcomes that result from certain transportation and infrastructure planning. For example, we have looked extensively at developments such as the Beltline and how that can impact communities around the Beltline. We have looked at multimodal infrastructure and the impacts that can have on different segments of our population. And another very important theme in our research is the promotion of healthy places. Again, I mentioned tools such as health impact assessment that we've used extensively to evaluate urban development policies and programs and how they can impact the health outcomes in the communities that surround them. And I will talk a little bit more about the decision support tools that we have developed as a result of some of these projects later on in my presentation. So in setting the frame for thinking about equity, particularly within the United States, I would like to reference the Sustainable Development Goals developed by the United Nations. What are the Sustainable Development Goals? They are the blueprint to achieve a better, more sustainable future for all. They address the global challenges we face, including those related to poverty, inequality, climate change, environmental degradation, peace, and justice. The 2019 U.S. Cities Sustainable Development Report is a city-level report ranking 105 U.S. cities on progress towards the UN Sustainable Development Goals for 2030. The results show that there will be significant work to do across the board if the SDGs are to be achieved by 2030, as cities on average scored only 48.9% progress towards the target set in the goals. And I'd like to point to the some of the visuals on the screen here. A lot of the Sustainable Development Goals are inherently equity-related goals, such as no poverty, zero hunger. And you can see here that our top 5 cities are only about 65 to 70% there. And of course, I brought in Atlanta here at the bottom to see our own local community and how we're doing. And we're only about 48 to 49% there. So we have a lot of work that needs to be done. So why does all this matter? I think that in understanding where we're heading with new technologies and the idea of equity, it's important to understand where we came from. So if we think about this as an analogy to two rivers merging, I'd like to first talk about kind of the roots of equity planning as they pertain to urban planning, and how we are where we are right now. So the history definitely dates back to, say, the 1960s, where there was a lot of discussion and active discourse around equity planning, community development, advocacy planning, really to address the needs of underserved populations and inner city populations. And then we evolved to smart growth, which really took on more environmental connotations, the idea of land conservation, environmentally sustainable design, dense development, access to public transit, etc. But then along came environmental justice, or the idea that there were certain communities that were being disproportionately burdened with pollutants and toxins, and how do we then protect these underserved populations from those harms? And then they kind of fused to create the idea of equitable development. But then in the phase that we are right now, we are also seeing the secondary tributary of the big data technology, sensor networks, IoT, which is also giving rise to the notion of smart cities. So where are we headed? Are smart cities going to make the task of equitable development harder? Or when they're done with the purpose, are they going to help us then bridge this gap and come together for a common cause of promoting equity in our cities? That remains to be seen, and that is primarily the area of research that I'm interested in. So we had to frame smart community planning within the lens of equity development. We need a working definition of what that means. So what is equitable development? It's an approach to meet the needs of underserved communities and individuals through projects, programs, or policies that reduce disparities while fostering places that are healthy, vibrant, and diverse. So health is definitely embedded in that definition. And how do we do this? So one goal is to promote both people and place-based policies and programs in communities, adopt strategies to reduce local and regional disparities in income, wealth, and access to opportunity, channel investments to generate economic returns and community benefits, and last but definitely not the least, enable effective civic engagement. So I'd like to talk a little bit about the first and the last bullet points here. So at least in public health, we think of a community in two ways. One, it is an aggregation of individuals, and two, the community has a separate identity that rises above the aggregate of the individual. So the whole is greater than the sum of parts. And we have learned in public health that the idea of multi-level interventions, one that fixes the environment, simultaneously helping the people or the individuals who reside in that environment, is a much more powerful strategy to promote the reduction of disparities rather than just do one or the other. So this definitely echoes some of that sentiment. And then the idea of enabling effective civic engagement comes through the idea of empowering communities through information. How can we share better data sources? How can we make people better consumers of information, et cetera, to the point where we empower communities to be self-sufficient, to advocate for their own needs. All of these themes resonate with the idea of smart communities as well. But in order to really think about equity, we need to even understand where our vulnerable populations are. So how do we even define what a vulnerable population is? So I looked for some well-known definitions that help us then measure these metrics, because as we all know, what gets measured gets done, and what gets measured gets included. So let me begin by quoting the definition by the Agency for Healthcare Policy and Research. Vulnerable populations are those made vulnerable by financial circumstances, place of residence, health, age, or functional development status, ability to communicate effectively, or the presence of chronic or terminal illness or disability. In a nutshell, if we had to break that down into two themes, it's evident that vulnerability can be created by both the presence of a risk factor or the absence of a needed resource. So let's take a minute to look at how these indicators or metrics pan out across the United States. So I put together a series of maps that visualize some of these common indicators that we're all familiar with. And I want you to pay particular attention to the patterns, right? I very purposefully put up quartiles rather than actual numbers, because I want to call your attention to the visual patterns. So we talked about the idea of vulnerability created by the presence of a risk factor. So let's look at percent of population with disabilities. Now we're seeing some trends here where we see higher data clusters sort of in regions in the southeast. Let's look at percent poverty, which can then denote the absence of resources. Again, some patterns here: southeast, premature mortality rate. Now, I purposefully picked premature mortality rate because mortality rate is very heavily correlated with age, but premature mortality rate denotes that people are dying earlier than the usual expected life expectancy. So, or people have shorter than expected life expectancy. So that can raise some questions in terms of why that is. So here we see an indicator that is created either by the presence of a risk factor and the absence of a resource when they come together. And then here we have percent of population or households without internet connection. Again, vulnerability created by the absences of resources, right? Again, the pattern we notice here is clusters of high values in the southeast. Now, putting all of these together, what are we seeing? Are we seeing the usual suspects or new vulnerabilities? So in looking at all of these together, are we seeing new vulnerabilities emerging due to smart technologies or the exacerbation of existing disparities? Again, something that needs to be researched and tracked. So in kind of transitioning to more of the types of research that I'm interested in and I've been doing over the past few years, I look for common definitions between public health and in, again, the urban planning profession, which have common roots historically, but that's a long narrative to tell, and I will save that for another day, which is definitely a very important and interesting narrative, but nonetheless, in the interest of time, I will talk about the commonalities here in public health and urban planning in terms of their shared values in supporting vulnerable populations. So the ethics endorsed by the American Public Health Association states that public health should advocate and work for the empowerment of disenfranchised community members to ensure health and resources that are accessible to all. I repeat what the AICP code states, that we shall seek social justice to expand choice and opportunity for all persons, and a special responsibility to plan for the needs of the disadvantaged and to promote racial economic integration. So within that framework, I would like to speak briefly about some of the work and some of the conceptual foundations that drive some of my work. So here we see the concept of the social determinants of health. And to some of you, this may be a known concept. And so for some of you, you may be coming across this for the first time. So I'd like to take a little bit of time explaining this. So for the longest time, the focus of public health was on curing infectious disease. And once that problem was solved, there were other social forms of disease, such as suicide and chronic, and the rise in chronic disease that started to make public health folks kind of question the biomedical model and the idea of chemical therapeutics and vaccines, and said there's more going on in our society and we need to be more aware of that. So that caused a complete redefinition of the concept of what it means to be healthy. So it's a much larger framework now where health is not just merely the absence of disease. So there's the idea of well-being now that is equally important, which gives rise to the concept of the socio-ecological model of health. What is the socio-ecological model of health? It basically says that an individual's health is simultaneously influenced not by individual level factors, which is biology, age, sex, race, etc., but also by the environmental determinants. And these are hierarchical in nature. So they could be behavioral traits, social, family, and community networks, which we call the inter and interpersonal realms, the living and working conditions, and the macro-social determinants, which are the broad social, economic, cultural, health, and policy environments that we live in. A lot of my work is embedded in the living and working conditions, particularly around the natural and built environments, access to healthcare, and then understanding the socioeconomic composition of communities. So the image on the right talks about a framework that I have developed through my research, because I'm primarily interested in measurement. How do we better measure socioeconomic composition? How do we better measure built environment and health? Because these are all gaps that are currently in the literature that we don't know much about. So a lot of my work looks at how different disciplines, for example, urban planning, social epidemiology, landscape epidemiology, how do we measure built environment? And what kinds of information are we gleaning from this so we can better inform how the built environment impacts our work and our health? So some of the work I've done, it really falls into two buckets. Using spatial analytics and machine learning algorithms to better understand the relationships between built environment and health disparities. And the second bucket involves building decision support tools to help reduce health disparities. And I'll talk about those two aspects in a second. So as you can see here, I'm primarily, like I mentioned, primarily interested in measurement and then developing better models and metrics to characterize health disparities and then investigate their connections with built environments. But also using spatial analytics and other statistical methods to build decision support tools to help organizations get smart, not just communities, but help organizations in making better decisions in resource allocation, and also really investigating and targeting where these underserved populations are. One of the tools that we worked on at the Center for Quality Growth and Regional Development is called the Health Assessment Decision Support Tool. And this was a outcome of a project that was funded jointly by the Robert Wood Johnson Foundation and the Pew Charitable Trust. And it was really understanding freight patterns within the state, particularly with knowing that e-commerce is growing and understanding how freight movement is only potentially going to increase within the state. And really understanding what were the vulnerable populations along these freight corridors and understanding what their health impacts might be from this increased freight movement. So again, it involved a lot of analytics, including the calculation and projection of air pollution from freight movement, the dispersion models, using transportation dispersion models, and really understanding population-related vulnerabilities, for example, age, asthma rates, other such health vulnerabilities and social vulnerabilities, putting them all together in a tool to develop some sort of a composite score index. But what is also neat about the tool is it gives us opportunities to create scenarios under different growth models, right? So if we see 5 years from now what that scenario looks like, 10 years from now what that scenario might look like, based on current projected rates. But then what if we introduce a technology where freight trucks are not polluting as much? How do we then change our vulnerability scenario modeling based on those different potentials, right? So that was one of the tools we worked on. Some of the tools that I have led the development of is in understanding, for example, the location of several healthcare resources, whether it be safety net programs, cancer treatment, and really understanding population access to these resources, and how do we, for example, better match transportation programs to help these communities that don't have access to get to treatment options, to get to preventive health programs, et cetera, et cetera. So these are some of the decision support tools that I have worked on, again, in an effort to make organizations that provide these services do it in a smarter way. I also like to talk about trends that I'm seeing, which are very exciting. For example, Javion is a private sector company whose specialization that they phrase in their own words is clinical artificial intelligence. And I particularly am excited by their work because they use socioeconomic factors in their modeling. They use social determinants of health in both detecting high-risk populations and in prescribing solutions within the clinical community. So doctors can see if a patient has inadequacies in terms of transportation access. So this is very exciting work because what it's doing is exactly using or working within the socio-ecological model of health framework to address some of these disparities. I used to often, I like to it's a very simplistic explanation, but I often say it's easy to give somebody a prescription to walk, to go back and walk more. But if there's no place to walk, what use is that prescription? So that immediately brings to mind the fact that a person, healthcare is not just in the walls of the hospital or the clinic, it goes way beyond that. So these technological advances, particularly in the health field, really start to look at addressing disparities. Another area that I'm particularly interested in is the idea of what is going on in the non-emergency medical transportation sector, which has been a Medicaid benefit that has been around forever. But we also know that there's problems with NEMT provision because they're not timely. But what NEMT providers are now doing is partnering with Uber, Lyft, and other types of shared mobility services to really provide on-demand responses to improve their service provision. And as a result, there's several digital platforms that are now coming up that enable folks to sign up for rides in an effort to, again, improve access for disadvantaged populations so that they're better able to get preventive services. And as we know, prevention, then the better the prevention, the less likely that somebody's going to land up in the emergency department with an acute onset of a condition that could have been better controlled at home. Another area that I'm really fascinated by is the smart connected health and the smart health communities. Some of the principles of smart health communities include proactive health and well-being management, or empowering the community, foster a sense of community well-being, enabled by digital technology and behavioral science, meaningful use of data to improve outcomes, and the enabling of new innovative ecosystems. And this project here through Air Louisville definitely resonates with some of those principles. So greater than 63% of Louisville residents live in neighborhoods with a life expectancy below the national average. And people can experience an 18-year gap from one neighborhood to the next. Again, no surprises here. Most of them are minority populations in fair or poor health. 1 in 5 residents lives in poverty, high unemployment, and air quality is a huge problem in Louisville because it sits in a valley where toxic pollutants generated by nearby coal and oil burning power plants and other industrial facilities collect in the stagnant air. As a result, asthma is the 3rd leading cause of hospitalization in Jefferson County, which includes Louisville. So there was a number of groups that got together in an advocacy effort and got funding to do 2 things. One, they put up kiosks in different parts of the city with environmental sensors that measured air quality, right? And it's an interactive kiosk so folks could learn actively about the air quality as they were passing by these kiosks. And then the participants in the study were given GPS-enabled inhalers to record where they felt symptoms and take measurements at that point. So there was an interactive component where at one point you were recording the air quality, but on the other point you were recording where people were feeling sick and had to take extra medicine because they felt like an asthma symptom coming on. So it's a really cool use of combining separate sets of data and really thinking about policy level measures to use that data and reduce or improve air quality. So With that, I would like to then transition into what we're trying to do in Macon, which is heavily driven by digital inclusion principles. Basically, what is digital inclusion? It is characterized by affordable and reliable access to broadband internet services, availability of internet-enabled devices that meet the needs of the user, access to resources that enable digital literacy, self-sufficiency, participation and collaboration, again, pointing to some aspect of training and education around data consumption and data access, quality technical support for when things don't function the way they're supposed to, and then intentional strategies to reduce, eliminate historical, institutional, structural barriers to the access and use of technology, again, resonating with the equitable development philosophy. And these definitions were adapted from the National Digital Inclusion Alliance. Now, it's very tempting to think of the digital divide as a distinctly rural problem, but data and statistics show that 3/4 of the 20 million American households who still lack home broadband or mobile data connections live in urbanized areas and are very likely low income. And there's still an urban digital divide, and smart communities could make it worse and even exacerbate disparities in other domains. It is important to remember, at least some of the core concept that drives my work is that access to information is a means to an end, and the creation and deployment of digital infrastructure technologies that enable information sharing is not an end in itself. Again, gives us a pause to think about why are we doing all this and to what end. So I think a lot of you in the audience are probably very familiar with what we're trying to do in Macon, is to really reach these underserved populations and find a way of engaging them and improving their access to information. And this project definitely did not happen in a vacuum. There is Macon is already on a journey to being a smart community, but then also a smart, inclusive community. That can definitely be seen through their existing smart community initiatives and open data initiatives. I have on the screen here the Macon Insights GIS hub, which has several sources of open data, but there's also several other smart applications that were rolled out in the timeframe of 2018-2019, which grow in demand and popularity, but then again, not within the reach of every member of the community. Macon Insights also has the Data Academy, which has trained a few cohorts in the use of data and made them more data literate, which is again a very neat foundation. So it seems like they have the building blocks in place to really grow this and truly become inclusive. So what we're doing here, at least currently for this project, is we're trying to install a system of kiosks, really a system or network of information sharing technology here. So we would like to install these kiosks in at-risk areas or in areas that are frequently used by these disadvantaged communities. And we are in the process of identifying those currently through our research. So in order to first get started with this project, the first question we asked is, where are these underserved communities, right? So we developed indices using well-defined measures of vulnerability that we see in the literature, particularly socioeconomic vulnerability, such as income, education, and poverty. And we used statistical methods to create these indices. But then on the right, the map on the right, we added additional levels of vulnerability. For example, we added aging populations, aging communities who, while they may not be vulnerable today, might be vulnerable a few years from now. But they're also vulnerable not from socioeconomic standpoint, but from reduced mobility. and those types of social isolation. So different forms of vulnerability here. Next, we are designing we have designed and we have deployed a geo-enabled survey that is really crowdsourcing information in terms of where folks would like to see these kiosks. And we have information on there that helps us track sampling patterns and it's not hard to guess that during the COVID-19 outbreak, we've run into some challenges in terms of survey response rates, and we hope that in a few months we'll be able to pick those up and really see what the community is telling us in terms of where the kiosks need to go. This is just a sample of the map that contains both our index as well as community selected locations. We are currently researching technology options in terms of what types of kiosks we would like to see in the community, and the Macon IT team is actively researching in terms of an asset management and procurement and deployment system. What are the advantages and disadvantages of these different systems? So where are we headed next? I recently came across some more data, so definitely looking at enhancing our indices using additional data sources such as the FCC Form 477, which really talks about the quality of internet access. I'm really curious about that data set. I would like to dive into that a little bit more. Again, hopefully increase our survey responses and so that we truly have a good understanding of where our kiosks need to go, and have a roadmap for that for short-term and long-term. Design the apps, the user interface, and the deployment of a demonstration kiosk so that we're able to really start evaluating outcomes. And that is an area that I'm particularly interested in terms of how do we track return on investment? What are the metrics that we need to use that when a community invests in smart technologies, is it observing, or is it really getting the benefit of it? And based on the objectives that they set out, are they seeing the results? And to really guide some of this work, a deep dive into digital equity and digital inclusion plans will really help us develop some of those metrics that we hope to develop in terms of if you set out to be a smart, inclusive community, what are some of the goals? What are some of the supports? What are some of the building blocks and the foundations of creating that right from the get-go? And then to conclude on my presentation, I'd just like to quickly summarize some important takeaways from today's talk, which is that the digital divide is not purely a rural phenomena. We can find it in all of our communities, even in urban areas. And if we frame smart community planning using an equitable development lens, we can potentially help bridge the digital divide, mitigate disparities in employment, education, health, and other societal domains by enabling access to information or equitable access to information. And last but not least, we improve civic participation and community empowerment, where communities are now fully equipped to advocate for their own health, for their own well-being, and for their own sustainability. So with that, I would like to thank you for listening this afternoon, and I'm happy to take questions.
Thanks so much, Arthi. Yeah, we'll take your questions now in the chat area if you want to type them in. It looks like we already have a couple of questions to go through. So Arthi, I'm happy to help you read through these if that helps. So we have a question from Sandra Bayer. Thank you so much for your question. She's looking for some more specific examples that you could potentially give to help disadvantaged populations like the homeless. And is there anything that you can recommend for a type of collaborative approach that we can use to improve health outcomes after we emerge from this pandemic?
Great question. Thank you. So while I'm not aware of specific technical solutions, I know that we have partners in the Atlanta area that are doing a lot of work around homelessness and homeless populations. I know that there's a really good partnership between Grady Memorial Hospital and the United Way in terms of helping the super utilizers and emergency departments by providing them with more stable housing, because in some ways that is considered the real starting point in stabilizing somebody within society and helping them achieve metrics such as employment and then long-term health stabilization as well. So, but I'm happy to look into other solutions as well, and please feel free to contact me. Greg, did you mention? Yeah, did you mention? You said post-COVID. That was the second part of the question.
Yeah, if there were collaborative approaches that could be recommended that we can use post-COVID.
So I think that as we go through this as we live through this epidemic, and as more and more folks are researching, I think that the kind of the disparities and the gaps in terms of which population groups are facing more severe outcomes is becoming more and more evident. Definitely underserved populations seem to be, facing the brunt of this. And in fact, I'm using some publicly available data to actually do an analysis with my students in my public health analytics class, looking at, again, the social determinants of health in addressing these. So I think there are a lot of existing collaborations around that. But the issue with social determinants of health is it's a very long-term approach to equalizing disparities. So if we were already doing a good job with that, I think we may see fewer severe outcomes. So I would say, things like the Arthi collaborative in the Atlanta area. They're all very actively working on, collaborating with multi-sector partners to address social determinants of health. So I think this is something that needs to be amplified, if not anything else. Another great opportunity that is on the horizon, or well, has been for a few years now, is the community benefit. The community benefit mandate that nonprofit hospitals have to participate in per the Affordable Care Act, in really looking at bringing healthcare outside of the hospital walls and investing in communities as a part of their tax exempt status, and that is how they earn tax exemption, by showing that they're investing in their community. So this forces, in some ways, the medical community to really take on the social determinants of health, and that has brought on other types of collaborations with community stakeholders. So I think that there are the seeds of really good things happening, and I hope that they continue and we see those benefits.
All right, thanks, Arthi. Next, there's a question from Nisha Bachwe. She seems to be trying to ask some questions about the Macon project and your survey, and how you're really reaching the disadvantaged population and how you're using that data to determine kiosk locations.
So I think that has been, again, one of the challenges, since this was an online survey. The Macon community advertised it heavily, got it through their public media outlets. But again, we're trying to reach populations that may not have access to digital infrastructure. So we had come up with a plan to survey through traditional methods, but just when we were about to deploy that plan, COVID hit, and unfortunately, we've had to put that on hold for some time. Hopefully, we'll be able to get back to that soon so we can really gather that information.
Understood. Thanks. There's a question from Jason Reedy. If there are short-term metrics for success in different areas, I'm not quite sure specifically what he's referencing, but what kinds of metrics, Arthi, do you use to determine successful programs?
So I think in the evaluation community, there's really, we look at process outcomes and we look at process metrics and then long-term outcome metrics. So process metrics are really the quickest thing we can do in terms of, after we deploy a program, is one, how good was the process with which the program was designed and deployed? So did we engage the right people? Was the plan robust? Did it include, all of the objectives? Does it include measurable objectives? So it's really, if you're looking for a short-term turnaround, it's about really measuring the process. Unfortunately, at least in the health field, if you're looking at health and equity metrics, these can take several years to manifest, and there's not enough literature out there that tells you what that time lag is. So it's really about tracking over time. This is something that we hope to address in our, as part of one of the deliverables of our Macon project, is to really, have those short-term, long-term plans for evaluating projects.
Okay. Last question that's currently on the screen is, in terms of using technology as a driver for economic development in distressed areas, do you see any communities or any examples that are actually doing a good job?
So I think that there are several examples of equitable development that really try to drive the economic development as well, because they kind of go hand in hand. In terms of specific technologies, that's something that I have to look into, but I'm happy to get back to you on that. I can't think of an example right away, but definitely something I can look into.
Okay, one last question that came through. Can you suggest sources for specific research or data that's correlating, providing connectivity to the community, to the overall well-being of the community?
So I just recently came across the Purdue Digital Equity Index, which really talks about observing qualities that are tied with digital equity, which was very interesting to me, and I'm definitely going to use that in some of our work with Macon to enhance the existing index we have. But in terms of enhancing, yes. So if you look at the Digital Inclusion Alliance, they have a lot of white papers and resources that specifically look at publications that talk about the different benefits of improved access. So I'm happy to share that link with you, Greg, if you want to. There's several papers out there in their database. So there's published work.
Okay. Thanks, Arthi. We'll just give everybody just a couple more seconds to see if any other questions come in. And we did just get one. So smart city work seems to be inherently multi-stakeholder, and the work transcends different sectors, which can be stumbling blocks to success. What have you learned about engaging with partners, especially from the smart cities perspective and non-traditional partners like neighborhood associations?
So I can definitely think of, so when I reflect on smart communities work, I have a deeper background in the health aspect. So I can definitely reflect on a similar multidisciplinary approach when we do health impact assessments, because that definitely requires an extensive multidisciplinary engagement with urban planners, public health folks, community stakeholders, etc. It's always interesting to think about things where the community has these insights which you may never have thought about, and we always learn that when we keep talking about health, it seems like the most important priority in a community is really the economic development, which again we know is deeply tied in with health. So some of the lessons learned is to really listen to community voices, because there's deeply embedded knowledge in there which we don't have as experts and outsiders. Also, learning to speak a common language is very important, particularly from the data aspects. So I know that when planners engage with public health folks, it's always frustrating to learn that data is not available at that fine scale, that urban planners love, because neighborhoods are really small areas, and but public health data is not available at that scale. But there's reasons for that, and it has to do with the simple math of small area estimates and reliability. But so it's that cross-disciplinary learning that occurs, and learning the shortcomings from both sides. So I think that all of these lessons in terms of learning to speak a common language, understanding the drivers, the forces, and then really listening to the knowledge that the community has to share are all big lessons that can be equally applicable to smart community planning.
Thanks so much, Arthi.
Mm-hmm.
So that looks like that's it from the questions, and we're just pretty much out of time. So again, thank you so much for a great presentation and for everyone's participation. That concludes today's Georgia Smart Communities webinar, and thank you so much for joining us.
Thank you, everyone.